What is the function of insulin that helps the body? A. Grow in height. B. Use of glucose. C. Clotting of blood. D. Fight off infection. In option A, growth is primarily influenced by growth hormones and not insulin. Insulin is a hormone produced by the pancreas that plays a crucial role in regulating blood sugar levels. For option C, blood clotting involves platelets and clotting factors but not insulin. And in option D, it is the immune system that fights infections, although poorly controlled diabetes can impair the immune function indirectly. So with respect to the options we have, our answer is option D. Insulin allows the body cells to absorb and use glucose from the bloodstream for energy or storage. This process is vital for maintaining normal blood sugar levels and providing energy to the body. Question 2. What is the primary role of a PSW when supporting a client with diabetes? A. Administering insulin injections directly. B. Monitoring blood sugar levels and reporting abnormalities. C. Deciding on the client's dietary changes. D. Diagnosing complications related to diabetes. In option A, PSWs are not authorized to administer insulin unless they have been specially trained and permitted under provincial regulations. This task is usually performed by nurses or by the clients themselves. The role of a personal support worker when supporting a client with diabetes is to monitor for changes in the client's condition, such as their blood sugar level, and to report abnormalities to the healthcare team. This will ensure a timely intervention and help to prevent complications like hypoglycemia or hyperglycemia. In option C, a PSW can assist with following a prescribed diet plan but does not have the authority to make dietary decisions. This responsibility is for the healthcare professionals like the dietitians or the doctors. In option D, diagnosing medical conditions is outside the scope of PSW's duties. They are only trained to observe, report, and provide supportive care, but not to diagnose. So our answer here is option B. By focusing on observation, reporting, and following care plans, the PSWs play a vital role in managing the health and well-being of clients with diabetes. Question 3. What are the signs and symptoms of fractures? A. Bleeding. B. Swelling. C. Limbs looking bent or out of position. D. All of the above. In option A, if the fracture is an open fracture, the bone may break through the skin, causing external bleeding. For option B, swelling occurs due to tissue damage and the body's inflammatory response to the injury. In option C, invisible deformities such as skin appearing misaligned or bent unnaturally is a hallmark sign of a fracture. So, our answer here will be all of the above. All the options listed are signs and symptoms of fractures. These symptoms are usually accompanied with severe pain, reduced mobility, and tenderness at the site of injury. So recognizing these signs ensures a timely medical intervention and care for the injured person. Question 4. Mr. Rex has had his larynx removed due to cancer. What will he be unable to do? A. Sneeze. B. Swallow. C. Speak. D. Cough. Sneezing is controlled by the nasal passages and the nervous system and not the larynx, so Mr. Rex can still sneeze. Swallowing involves the esophagus and related muscles, but not the larynx. The larynx, which is also known as the voice box, is responsible for producing sound and enabling speech. So when the larynx is removed due to conditions like cancer, the individual loses their ability to speak naturally. There are alternative methods such as the esophageal speech and electrolarynx devices that can help the person to communicate. For option D, although coughing involves the larynx, individuals without the larynx can still cough by using their trachea and respiratory muscles. So our answer here is option C. When the larynx is removed, the individual will lose their ability to speak naturally. Question 5. What is the condition of having small pouches on the colon that bulges outward referred to? A. Diverticulosis. B. Tuberculosis. C. Fibromyalgia. D. Gangrene. Diverticulosis is the condition where small pouches form and bulge outward in the wall of the colon. These pouches often occur due to increased pressure within the colon, and they are often asymptomatic. However, if one of these pouches becomes infected or inflamed, it can lead to a more serious condition known as diverticulitis. Tuberculosis is a bacterial infection that affects the lungs, although it can affect other organs. However, based on the question, it is unrelated to the condition of the colon. Fibromyalgia is a chronic condition that causes widespread musculoskeletal pain and tenderness, but it doesn't have any issue with the colon. Gangrene refers to the death of body tissue due to infection, lack of blood flow, or injury. However, it is unrelated to the formation of pouches in the colon. So our answer here is option A. Diverticulosis is typically seen in older adults, and it is often discovered incidentally during routine screenings like colonoscopies. The condition can cause symptoms like bloating, abdominal pain, and changes in bowel habits, but many people may not experience these symptoms at all. Question 6. How many muscles form the human body? A. 200. B. 350. C. 500. D. 650. We'll be going with option D here. The human body contains approximately 650 skeletal muscles, and these work to provide movements, posture, and support. These muscles are voluntary, meaning that they are controlled consciously. Although there are smooth muscles, which are involuntary muscles, like those in the digestive tract, and also the one in the heart known as the cardiac muscle, they are not included in the skeletal muscle counts. Skeletal muscles enable smooth movements by working with the bones and joints. Smooth muscles, which are found in the internal organs, regulate functions like digestion and blood flow, while cardiac muscles is unique to the heart and it pumps blood throughout the body. Question 7. What is a complication from vomiting? A. Duodenal ulcer. B. Fluid retention. C. Aspiration. D. Myocardial infarction. Duodenal ulcer is caused by factors like excessive stomach acid or infection with Helicobacter pylori, but not by vomiting. Vomiting leads to fluid loss and dehydration, but not retention, so option B is not our answer. For option C, vomiting can lead to aspiration, and this occurs when the vomit is inhaled into the lungs instead of being expelled from the body. This can lead to serious complications like aspiration pneumonia, where the lungs become infected or inflamed due to the presence of foreign material. In option D, myocardial infarction is also known as heart attack, and it is caused by reduced blood flow to the heart, but not directly by vomiting. So our answer based on the options we have here is option C, aspiration. It is very dangerous, especially in individuals who are unconscious, weak, or have impaired swallowing reflexes. Question 8. Structures in the respiratory system includes A. Larynx, heart, and sinuses. B. Nose, trachea, and alveoli. C. Heart, lungs, and teeth. D. Mouth, esophagus, and lungs. The respiratory system includes various structures that works together to facilitate the exchange of gases, which is oxygen and carbon dioxide, between the body and the environment. The key components of the respiratory system are the nose, the trachea, and the alveoli. The nose is the entry point for air, and this is where air is filtered, warmed, and moistened. The trachea is the windpipe, and this is the passage that directs the air from the nose to the lungs, while the alveoli are the tiny sacs in the lungs where gas exchange occurs. Based on the options we've been given, option A is not the answer because the larynx is a part of the respiratory system. However, the heart and sinuses are not. The heart is part of the circulatory system. In option C, heart, lungs, and teeth is also not the correct answer because they belong to different systems in the body. The heart belongs to the circulatory system. The teeth are part of the digestive system. In option D, the esophagus is part of the digestive system, while the mouth is involved in the intake of air. But the esophagus is not directly part of respiration. So with respect to the options, our answer is option B. Nose, trachea, and alveoli are parts of the respiratory system. Question 9. Which of the following is a common symptom of a urinary tract infection? A. Increased appetite. B. Burning sensation during urination. C. Sudden weight gain. D. Difficulty breathing. A urinary tract infection causes symptoms like pelvic pain or discomfort, especially in women, cloudy or strong smelling urine, frequent urge to urinate, even when the bladder is not full, and burning sensation during urination. This is one of the most common and uncomfortable symptoms of a UTI. Looking at the options we have, option A, increased appetite, is not a symptom of a UTI. Option B, we've mentioned earlier, is a symptom of a UTI, burning sensation during urination. Option C is not typical of a UTI. Weight gain could be related to other conditions like heart or kidney disease. And option D, although it is a symptom, it is not associated with having a UTI. Breathing problems can indicate respiratory infections or other serious conditions like pneumonia. So our answer here is option B. Burning sensation during urination is a common symptom of a urinary tract infection. Question 10. What is an essential component of care for a client with chronic obstructive pulmonary disease? A. Encouraging vigorous physical exercise. B. Monitoring oxygen therapy and ensuring proper use. C. Restricting fluid intake to reduce respiratory efforts. D. Avoiding all physical activity. In option A, while physical activity is important for managing COPD, vigorous exercise is not recommended for most COPD patients, especially those with severe symptoms. Exercise should be tailored to the patient's ability, and it typically involves low-intensity activities in order to improve endurance. In option B, an essential component of care for a patient or clients with chronic obstructive pulmonary disease is monitoring their oxygen therapy and ensuring that it is used properly. Oxygen therapy is often prescribed for COPD patients who have low oxygen levels in their blood. This will help to improve the oxygen supply to the body, reduce symptoms like shortness of breath, and improve their quality of life. Option C is not recommended for COPD patients. In fact, staying well hydrated is important for thinning mucus and aiding in its clearance. And in option D, complete avoidance of physical activity is not recommended either. While rest may be necessary during exacerbations, regular low-impact activity like walking can help to improve the lung function. So for this, we'll begin with option D.